PSA testing is increasingly controversial. Depending on the guideline you cite, you can have people say, don't do it at all, or do it after some sort of informed consent, where patients participate in a shared decision-making model. No one today really says, just get a PSA and don't worry about it, don't inform the patient. So what I tried to do was to give a bit of evolution from the initial days back in the early 1990s, when the idea was that we would screen and PSA test everybody, to a current model where we understand that there are risks and benefits of screening. And I tried to show kind of an evolution about how we move from point A to point B. And if I were to summarize very simply, I would say that PSA testing has the ability to save lives, and I think that's generally agreed upon by people who look at the good trials, and particularly the European trials. If, on the other hand, you want to understand the harms of screening, you have to look at the overdiagnosis of these early stage prostate cancers and the over-treatment of those early stage prostate cancers that are probably never going to be clinically relevant. So what you have to do in order to understand this sort of complex scenario is understand that you can find the cancers early, but all the cancers you find early don't need to be treated, and then selectively treat the ones that need it.